are going to talk about diseases of gallbladder and bile duct. I'll try to make this video short and explain all the aspects of gallbladder diseases. When we talk about gallbladder, we are talking about gallstones mainly. Gallstones are formed because of the abnormal bile compositions. According to a study done for the prevalence of gallstones by NHANES3, which stands for Third National Health and Nutrition Examination Survey, according to the survey done by NHANES3, women are more prone to having gallstones than men. In their study, it says 16.6% of women and 0.9% in men, they will have chances of getting gallstone, and the more prone age group is above 50 years of age. Now we will talk more about gallstones. There are two major types of gallstones. They are colossal stones and pigmented stones. We are going to talk about colossal stones, which accounts more than 90% of all gallstone cases. Gallstone contain more than 50% of cholesterol monohydrate and plus an admixture of calcium salt, pigment, bile pigment, protein, fatty acid, etc. Now we will talk about pigment stones. Pigment stone only contain less than 20% of cholesterol. The main primary component is the calcium bilirubinate. Pigment stones are classified into two. They are brown type and black type. This will lead to a formation of secondary chronic biliary infection in our body. Now we can talk more details about the colossal stones. As we all know, colossal stones are insoluble in water. To solubilize cholesterol, we need the presence of lipid. Cholesterol and phospholipid are secreted into bile as unilamellar bilayered vesicles, which is later converted into mixed micelles. These micelles contain bile acid, phospholipids, and cholesterols in them. Now, let's talk about gallstones. How gallstones are formed in our body. If there is excess cholesterol in relation with phospholipids and bile acids in our body, unstable cholesterol-rich vesicles will remain in our body without being synthesized. This will aggregate into large multilamellar vesicles from which cholesterol crystals are formed, which we call gallstones. Now, let's talk about the formation of lithogenic bile. Simply, the stone formation mechanism. Talking about mechanism, we will talk about the most important one, which is increased biliary secretion of cholesterol. Now we know we have increased biliary secretion of cholesterol in our body. So what are the reasons for that? Most common reason is obesity, metabolic syndrome, high caloric or cholesterol diet. Even drugs can be reason for increased biliary secretion of cholesterol. When we talk about gallstone patients, there are some things we only see in gallstone patients. In patients with gallstone, dietary cholesterol will increase biliary cholesterol secretion. This will not happen in a non-gallstone patient even if the patient is having a high calorie diet. In addition to these factors such as high calorie diet, cholesterol rich diet, etc., even the genetic factors play a very important role in patients with gallstone diseases. Most gallstones associated with the UGT1A1 variant were colossal stone. This finding points to the role of pigment particles in pathogenesis of gallstones. Please like the video and subscribe my channel. The second part will be coming soon.